Can we talk about the pros and cons of medicating children or young people with these kinds of conditions? Are they going to turn into zombies? Are they going to... Two different questions. Why would we choose medication over what else is available, and what are the pros and cons if we do?
Yeah. So the pros and cons, weighing that up is really critical. Um, and it's difficult in child and adolescent psychiatry because often there's less research going on to drive clinical practice compared to the adult area. But yeah, where we see children and adolescents with those conditions I mentioned a bit earlier, ADHD, bipolar disorder, psychotic disorders, medication can be very helpful and will be used quite early in the treatment plan. For other conditions, anxiety, moderate to severe anxiety, depression, OCD, that group of conditions, usually medicine would be used after therapy has been attempted, or in more severe cases concurrently with therapy. And it's really looking at, is there significant impairment and significant symptomatology? Would that respond well to a medicine? How does that medicine compare to other treatment approaches? And if you have all those things together, then benefits tend to be things like reduction in symptoms, reduction in impairment, more functionality, better able to use therapy techniques, reducing stress in people's general lives, those sorts of things. The cons, and there are a few of them, notably adverse effects. So, that's often a very significant limiting step. Some people feel that taking medicines is a very, very big step and have a natural tendency not to want to use medicines. And that can be difficult, for them to adjust to the idea that a medicine could be helpful. And we don't tend to rush that process. So if people are needing some time to consider that, then that's time well spent. But some people, feel that it's an affront on their functioning, and it can have some impacts on people's feelings about themselves. That can be a significant disadvantage. Another con is that sometimes if you use a medicine, people can become overly keen on the medicine and may de-emphasize other approaches that might be necessary and useful. So, getting a bit too medication oriented. And I think just broadly, there's a bit of a risk with, wait lists being as they are, that, we have pressure to get people through the system. And I think sometimes medication is used earlier than it would have been in the past, where more therapy might have taken place. I think that's another con, another risk.
So, how do the outcomes compare when medication's been initiated earlier in the absence of therapy versus therapy and then medication being initiated?
Yeah, so there's some good evidence in some disorders or conditions around early use of medicine. So there's particularly depression. So there's a key study looking at therapy, CBT, cognitive behavioural therapy, versus a medication approach versus the combination approach, showing that medicine plus CBT resulted in a faster response, although many people would eventually get there with therapy down the track. So medication for depression, and the evidence base for depression for medicines in children and adolescents is moderate. It's not that great. So in that case it can lead to people getting a much quicker response. Time to response hasn't been studied that well in other areas, but I'd expect that you'd get a fairly similar result with OCD and with anxiety conditions, severe anxiety conditions.